I want to say that the approach of Ondamed is an intelligent approach. It is not just going by symptoms or by what one knows about one frequency, what one knows about one's pathology, because that's all limited. So in creating a personalized healthcare solution, it is essential that we tap into, as I call it, the knowing, which sits maybe in the subconscious of a human being, and working with that in understanding what tissue needs most attention in terms of therapeutics, and we ask through the autonomic nervous system. This is not some software-driven nonsense. This is truly like, stimulating, evoking a response, waiting to get that back. Just like when we listen through the stethoscope, we say, hold your breath. Well, that's also, biological change. And you listen to see if there's some crackling or if there's not. So it gives us a very quick access to the truth, to what is going on with the symptoms and pathology of that patient's health, life story. It's not just today, but we will be able to unravel things that usually in our first intake with the patient, we don't get to the most important issues, and the patient doesn't know and we don't know. So how do we access that information? Well, through biofeedback. And we make the patient aware of what it is that they respond to, of where it is on the body that they need the reaction treatments or the treatments to the reactions. So it is a teaching of their own biology, their state of mind, their emotions, their mental state. So it is truly, no other device does what Rolf has invented almost 30 years ago. I have the ornament right here. Let me give you an intro here. No, let's see. This always throws me for a loop. The opposite. Okay, neck applicator. Place that. So here are the ending of the coils are on each of the sides of the neck applicator. And then I already have a program running. As you can see, this is the time counting down, 2 frequencies coming out. Why 2? Because we have 2 channels, right and left channels. So they're being shown here one at a time, but they're coming out at the same time. They're being pulsed. And so here I can now palpate the patient's pulse or palpate myself. So let me take care of that here. Just move that so you can see. So I will palpate on here on my the temporal pulse. Mm-hmm. And I can just, as I'm stimulating with the handheld, you see it's the same piece. Just now I can move it. I listen through my fingers. I can use 3, 2, 1, doesn't matter. And I wait for response.
So she is waiting for a change in the pulse. So the point is it's a process. It's not done by a sensor, but by your finger. So you are the feedback input as a therapist, and as you move the applicator along the body, you may feel nothing or no change, but suddenly there is a change, a slight change. And these changes are essential for your assessment and of course also for your treatment. So it's not a feedback like you know it from the regular biofeedback, but it's a similar loop. I stimulate, and I'm awaiting a response of the patient. So it doesn't matter if I look for different frequencies or programs, or if I look for body locations. It's working either way, and I would explain how it works. why does the patient respond? Because there is a hesitation or a fear which is evoked when I go to a certain point or location on the body. And this is exactly then the very important and useful information for treatment.